Tuning in and joining us today for Mental Health and Franklin County Resources. Franklin County Department of Job and Family Services Virtual Lunch and Learn. My name is Joy Bivens, and I am the Deputy County Administrator of Health and Human Services for the Board of Commissioners. And I'm excited to host and facilitate today's Lunch and Learn on behalf of our Franklin County Commissioners, Commissioner Kevin Boyce, Commissioner John O'Grady, and Commissioner and President of the Board, Erica Crawley. We're excited to launch our first three-part Lunch and Learn series focused on mental health, featuring the Office of Justice Policy and Programs and its local providers. Our second and third Lunch and Learn in this series will also be held on the second Wednesday of the month in March and April at 12 p.m. In this series, our discussion will center around residents struggling with mental health, including opioid addictions, violent crimes, traumatic events, the impact on families, and county resources available to residents, which is really important. Today, we are discussing mental health, and we have a jam-packed schedule today, so I'm gonna try to get through it all. But again, today we're discussing mental health as it relates to the opioid addiction. Before we begin our conversation, I'd like to share a bit of background just so you'll know why this conversation is so critical for the mental health and well-being of our residents. Afterwards, we'll dive right into questions for our panelists. The COVID-19 pandemic is having a significant impact on mental health and well-being of many of our residents in the community. In June 2020, the Center for Disease and Control reported and found that substance abuse disorders, anxiety disorders, depressive disorders, and suicidal thoughts were all on the rise. For example, from June 19 to June 20th, 3 times as many people reported anxiety disorders, 4 times as many people reported depressive disorders, 1 in 10 people started or increased substance abuse. In June 2020, as compared to the entire year of 2018, twice as many people seriously considered suicide, unfortunately. So what is Franklin County doing to address this increasing mental health crisis impacting our residents? Well, studies have shown that as many as 75% feel more comfortable talking or taking a self-paced approach in addressing their own mental health issues. The stigma associated with mental health illness likely plays a role in this, but we recognize that we are in the midst of a mental and behavioral crisis as well. We have been for some time now. It is imperative for us to meet people where they are, and that's where the Incredible Minds platform comes in. Our Franklin County Commissioners have founded the Incredible Minds technology platform to connect families with national and local resources to address their mental health and emotional challenges. The website is www.franklincounty.ohio.credibleminds.com, which allows Franklin County families to search for information and resources on over 200 emotional mental health topics. Visitors are able to take a variety of self-assessments and be connected with apps, podcasts, videos, articles, and books on the platform. All this information is evidence-based and approaches that we are all known to help with a variety of mental health and well-being topics. It also provides us with access to analytic data to track different trends and platforms, which could be really helpful in addressing and dispatching resources to the community. The Board of Commissioners addressing mental health through the Franklin County Ohio.Credible Mind website also supports goal number 9 of our Rise Together Poverty Blueprint Plan. So now that I've gotten the data out of the way, joining us for our discussion today are our panelists, Caitlin Looney, and this keeps popping up on my screen, so I'm gonna dismiss that. Caitlin Looney, Grants Coordinator at Franklin County Office of Justice Policy and Programs, and Morgan Brown, Social Worker at North Central Mental Health Services in Franklin County of Justice Policy and Program. We are providing you today with information about mental health, opioid addiction, and various resources offered through Franklin County Office Justice Policy and Programs. One of their providers in their county's mental health website. Thank you all for participating in our conversation today, so our residents can learn more about the information and resources that are available to them. Also with us today is Andrew Krismer of Franklin County Department of Job and Family Services, He is going to walk us through the Franklin County website to provide us with overview of the new online resource for our residents that I just spoke about. Thank you for joining us, Andrew. How are you doing today?
I'm good.
Okay, well, please walk us through this incredible resource, Incredible Mind.
Okay, so I'm going to share my screen here so everyone can see. And as you can see, the website is up here. We'll put it into the chat for everybody. As the Deputy County Administrator said, this is a free resource. It is open to anyone in Franklin County, and it is anonymous. There is a sign-in feature, as you can see here, that can track progress or track the resources that you are using, so that you can bookmark things. But if you just want to search around on your own anonymously, it is completely up to you. So this is the launch page here, and as you can see, it jumps right into resources. These are all of the partners that we have so far, and then as you scroll, you just get some of the top resources from the county. So these are the most popular ones. There's some really good resources for parenting and burnout. I know that a lot of parents have sort of remote learning whiplash. It's kind of going back and forth between the classroom and remote. So there are definitely all kinds of different resources on the launch page. And then you can also sort by topic. So as you can see here on the left-hand corner, spiritual health, physical health, personal growth, anxiety, stress, depression. These are some of the top topics in Franklin County. There's a blog as well. So these are written by experts in the field. There's specific news that you can look at. But then the real heart and the meat of the resources that are available are these self-assessments. So the Deputy County Administrator briefly stated, we need to meet people where they are. Well, sometimes these assessments can be the first step, right? So there are some shorter assessments: social support, is caring for others taking a toll on you? Is it job stress or burnout? But the kind of signature one that the signature one is over here, and you can also access it in the assessments, but it's a 12-minute assessment. And so if you click here, it's going to take you through a guided survey, and you'll see questions that are kind of general at the beginning. And then it's going to get into more specific questions about your job, about your love life, about family or friends, and social and spiritual networks. And one of the things that I always like to point out when I'm doing these demos is these are all peer-reviewed survey design questions. And if you want to kind of understand why something is being asked in one of these assessments, you can read up on it, because everything is academically and peer reviewed. So it is a scientific based survey. I'm going to kind of cheat. So I did fill one out randomly. So it's going to be, I think, 5 pages. It'll take you about 10 minutes, really. And what the results are going to look like. So this is a mock-up of the summary of results. Areas where you're doing well. So, worrying, body image, these types of things, it's of less concern to people. And then areas of some concern, drinking. I know a lot of people have been drinking a lot during the pandemic, have been more stressed, have been eating more. And then areas of greater concern that maybe you want maybe you want to read about, maybe you want to sort of bookmark some blogs or podcasts about, or maybe seek a professional opinion from your medical doctor or a counselor. And then community resources down here. You know, there are just all kinds of different things that are self-guided and at your own pace. And that's why the Board of Commissioners and the county administration really thought that this was a great resource. And we've had, we launched a few months ago, and each month we just get more and more people who are visiting the websites and filling out the assessments. And the analytical piece behind it is that we see what people are clicking on from the back end each month, and then we can tailor the resources more in favor of those things that our community are specifically dealing with. So I'm available for questions. I can, you know, put my my info out there. But I will put this into the chat, the website. But that is, in a nutshell, the platform. Thank you.
Thank you, Andrew. I was trying to take myself off mute. You would think I would be a professional by now. So thank you, Andrew, for that overview. I hope our residents captured all that information. It can really be helpful and a really strong resource, the Credible Minds resource. So today, again, we have with us Caitlin Looney and Morgan Brown, and we are excited to have a dialogue with them, not just on mental health, but also resources, right? So we really want to dive into it. Welcome, Caitlin. Can you do us a favor and just tell us a little bit about yourself and what role do you play at Justice Policy and Programs?
Absolutely. Thank you so much for having us and facilitating these conversations about mental health. Morgan and I are both very passionate about this. We're thrilled to be here. As mentioned before, my name is Caitlin Looney, and I'm the grants coordinator for the Office of Justice Policy and Programs, or OJPP, as I'll call it, because it's less of a mouthful. I have worked in the justice field for a long time, about 13 years, and have a background in social work. I've done direct service within our institutions, but now I am a grants coordinator. So I assist with applying for grant applications that could help us meet the needs of our community at large, and then administering those grants, which means overseeing program implementation on a high level and ensuring the programs and partners we have are meeting the needs of our residents in alignment with the values and the priorities of our commissioners.
Again, if I can just take myself off of mute when I'm supposed to. Thank you again, Caitlin. I really appreciate you sharing that with us. What is the association between mental health disorders and opioid addictions?
So as a social worker, this is something I'm really passionate in talking about. So there is absolutely a great connection there. So according to SAMHSA, or the Substance Abuse and Mental Health Services Administration, people with mental illness are more likely to experience substance use disorder than those not affected by a mental illness. And so mental illness and substance use disorders actually have several overlapping risk factors that are important to consider. So they both have risk factors that include genetics. And this is really important to understand. Genetics actually makes up about 30 to 40% of that risk factor pie. That's a huge thing to understand whenever we're trying to learn about mental illness and substance use. Brain development is also important. It's not only the physical development of the brain, but it's where that brain, the environment that brain developed in, is really important. And then also the exposure to trauma and adverse childhood experiences greatly impacts the likelihood of mental illness and substance use disorders. So while they don't always occur together, mental illness and substance use, it is common to see them co-occurring. And when we talk about the population we serve, which is individuals with a history of justice involvement and their support systems, you layer in that individuals with mental illness and substance use are actually at higher risk for incarceration and arrest. And you can understand why jail populations across the country see a huge number of co-occurring disorders with their populations. Franklin County is on par with that. You know, our commissioners, and I'll only briefly mention this because I think it's important to our conversation, they took a bold step in 2015. And it's important to the work OJPP does of signing a call to action for the Stepping Up initiative for Franklin County. Stepping Up is a national initiative. And what it seeks to do is to reduce the jail population of individuals with mental illness, because it does not help a person with a mental illness to be incarcerated for a long period of time. And our commissioners took that bold step to say, hey, we're going to address the challenges we're having and commit long-term to addressing them for our residents, which was really amazing.
Thank you for sharing that, Caitlin. You know, as you were talking, I think there is a difference between empathetic scientific approaches versus non-empathetic and policy-driven approaches, right? One can be very transactional, one can be very transformational. And we're talking about mental health. When you track things back to childhood traumas, you know, the way that a young person's brain develops, understanding that a young person's brain isn't fully developed and probably into their like 20s, and taking into account some of the genetic makeup, we have to be very intentional about looking at people, not just for face value, but who they are, what they come from, and their genetic background. So thank you for sharing that. Morgan, how are you doing today?
I'm well. Thank you for having me.
Good. I'm excited to have you. And I love that color. It's very springish on this very wintry day. So thank you.
We needed something.
Thank you.
You're
so
welcome.
Can you tell us a little bit about yourself and North Central Mental Health Services?
Yes. So I started with North Central in 2016 as a qualified mental health specialist. And then a couple of months later, I became licensed as a social worker. So that's when I really started doing those clinical services, counseling, case management, assessments. And then in 2018, I moved over as a contractor for OJPP and doing the safe stations. But you can also catch me doing pathways and the Rapid Resource Center. Anything that I can do that's kind of direct service and just working in the community, I love. So you'll see me everywhere.
Now, how have you seen the pandemic impact residents who struggle with both mental health and opioid addictions during this current pandemic?
Working with SAFE, I definitely noticed a lot of the overdoses kind of just rising. And it led me to realize that the isolation, lack of connection just wasn't really conducive to the population that we served. And it also, we had to take into account the loss of jobs that people experience, the financial insecurities, the food insecurities, and just not having the kind of awareness on how to get help or like where to turn to because of the pandemic. And so we kind of had to take a step back as this pandemic forced us to do and to see how we can still connect with people. And so then we started moving everything to telehealth, doing things over the phone, just so we can kind of connect to people. But when I'm speaking to our residents and the population that we serve, I tell them to connect any way possible, whether it's attending peer recovery groups, whether it's just going to your sister's house every day after work, and just doing anything that you can to feel that love and to feel connection, because addiction multiplies when you're isolated.
So this is for both you and Caitlin. You know, many times pre-pandemic, we had access to going inside of places, feeling comfortable, and sitting down talking. How have you both seen the impact of COVID as it relates just to people, right? Are the masks, us having to wear masks, is that impacting it? Is it not? Is it the lack of sociability, being social? Is that impacting? And if so, how are you all being creative in ensuring that residents get the resources that they need? Because again, at certain places, lobbies aren't even open.
Yeah.
So whoever wants to that's a loaded question, tackle it how you want, but let's chew on that for a little while, Caitlin and Morgan.
I can go first. I'm a person who I like to know exactly what's going on when I go somewhere. I want to know what's there. So when I'm doing these screenings, making referrals, I talk to the clients about what they can expect when they go to treatment, who are some of the faces that they will see, what's the environment like, what you can bring, and I just let them ask away.
Yeah, I mean, Morgan really hit the nail on the head with this one. Just like everybody, in uncertain times, you really lean into certainty. And so the best picture that we can paint for individuals, whether being released from a correctional facility or their community member that we're working with, maybe seeking treatment for the first time, or riding the bus for the first time, or having to access Zoom for the first time, it's what peer supporters, case managers can do on a day-to-day basis to walk them through those steps. It can be as simple as making sure that the individuals released from our correctional facilities are provided a mask upon release. So if you don't have a mask, you can't get on public transportation. You can't go into the building to see your probation officer, parole officer. You can't even access your mental health case manager or treatment services. So something as small as a mask, it can unlock so much for an individual. And then a friendly face. So we do the best that we can do in all of our different locations and with all of our providers to make sure we will take precautions to make sure everybody is as safe as we can make them during the pandemic, but we want it to be personal. So clear glass, seats that are 6 feet apart so we can still have a conversation and look people in the eyes. We can still sit next to them or sit right across to them with that distance. We want to make sure that people understand while the environment may look different, the passion, the humanity has not changed. And so we take a number of different approaches, even making sure that our clients with family members, that their children have access to things that they need to go to school or access to remote learning. Those different things can relieve stress in such a big way to allow our residents to focus on their mental health and focus on their recovery.
Thank you for sharing that, both of you. Let me ask you this question, and I'm going to get to some of the more technical questions. But, I think for people that live in the community, we all know someone who has been justice involved. We all know someone who is dealing with mental health. We may have a family member or have a best friend or a neighbor who have recused themselves or for whatever reason, right? For justice involved residents, as well as everyone else, young people, neighbors, friends, cousins, parents, how can we as residents support our neighbors who we see may be struggling with, whether it's addiction or mental health issues? And this is for both of you, however you want to answer that.
Absolutely. I think regardless of a person's background, it is connection. It is checking in. It's as simple as, hey, saw you taking the kids to school. You're doing great. You're amazing today. Get those kids out the door. I hope you got to drink hot coffee, or drop off that cup of hot coffee on the porch for them. It can be as simple as, helping out with childcare. Childcare is a huge barrier for our population to access all kinds of appointments just to move their life along from their justice involvement, let alone address their mental health and their substance use. It's maybe making sure that if their computer goes down and they can't access their recovery Zoom meetings, can you lend them your laptop or your phone for an hour so they can connect to their recovery community? It's making sure they know what resources are available. If they share with you that they're struggling with something, even if you don't know the exact resource, please take our information. Say, hey, I can't help you directly, but take this phone number, call them, and they will be able to help you. And that makes a huge difference in reducing that isolation and creating that sense of community for them.
You said it.
You said it, Morgan.
You said it.
Yeah. And I love the whole, if you see someone taking their kids, I see people taking their kids to school all the time. And that whole just dropping a cup of coffee off. I mean, how many times do I pass a coffee store that I can drop off a cup of coffee to several of my neighbors? So thank you for sharing that. Can you, Caitlin, talk to us about the initiatives or services, I'm going to not use government acronyms. I hate when people acronym me, Morgan. It drives me nuts. The Justice Policy, the Office of Justice Policy and Programs, what services and initiatives do you offer with people and residents who are struggling with their mental health and addiction? And then Morgan, I'm going to come to you next and offer you the same question.
Great. And she's going to hit on one of our bigger ones, which is safe stations. So I'm going to leave all of that for her. She's the expert, our guru there. Other resources that we can help offer. We have a reentry resource guide, which we're providing the link that you can access online in the on the Facebook Live. This is a section of our website dedicated to community resources for individuals with a history of justice involvement. It's a wide variety of everything: food, clothing, ID, common needs for our residents, but there's also a section for mental health and substance use where you can find resources that are geared to specific needs. We're also going to be out in the community. I know, County Administrator Bivens, you've been such an asset. We are so excited. We're going to be able to send our specialists out to the communities to serve you where you are through the Health and Human Services mobile unit starting next week, which is amazing. So please keep an eye out for where we're going to be and when. Our office will be represented there. So please come out and see us and allow us to connect you to services. If you have a friend or loved one incarcerated at our Jackson Pike jail facility, or you were recently released from that facility, stop by our Rapid Resource Center to work with our peers and community partners. That's actually located in the North Visitation lobby of that facility, and you can just walk right in. If you're there for a visit, you can stop in as well, request a peer support, or go see your loved one while they're incarcerated to start assessing their needs and begin linkages. But we want to encourage as many people as possible. Tell them we're out there, tell them to come in. We will get them a cup of coffee, we will get them a snack, we will get them safe transportation, and we also have people there to say, hey, do you want to go to detox today? Do you want long-term treatment? How is your mental health? Do you have a case manager? And we will help make those connections. We also have a brand new program called the I Father a Child program, and this is really exciting. So this program supports incarcerated fathers and offers them an opportunity to gain access to resources that allow them to recommit to fatherhood. So their children are offered leadership development, homework help, mentorship, and access to trauma-informed care. So research tells us that incarceration of a parent is the third most harmful adverse childhood experience for a child. So this program addresses social determinants of health and offers early intervention for the mental health and well-being of the child. It also, and I love this part, provides services for our caretakers, our amazing caretakers who hold it down while their partner or loved one is incarcerated. We want to make sure they're okay too. So it offers resource navigation, network building, and work readiness and employment assistance. And we have all that info in the Facebook Live chat as well for you to reach our office and see if you're eligible for that program. But it's basically this holistic approach to help our families and our community gain access to trauma-informed care, which is amazing. We have a whole bunch of pre-release programs as well. If you have a loved one at Jackson Pike, tell them to check out the Pathways program, which really focuses on individuals with substance use histories and making sure they have access to curriculum, case management, to help that re-entry go a little bit smoother, and they can allow them to focus on their recovery and their mental health. And that's, I'm going to throw it over to Morgan for the exciting.
Yes, and Morgan, while you're talking about your services, I know you're going to hit on those safe stations. So why don't you go ahead and go into it so it can save me the later.
Okay, so safe stations, it's now going to be called SAFER, and that stands for Stop Addiction for Everyone Resource Station. And basically our mission is to reduce opioid misuse, addiction, and fatalities by providing that fast, safe, and discreet line to treatment. We work to create tailored treatment referrals by getting to that client. So as of now, how that looks is someone will just call me, it could be them or their loved ones, and let me know that this person is looking to get into treatment. And so what I would do is our screening and just gathering some information, some background information, demographics, current substance use, medication, any medical problems, just so I can take all of that and pass it on to the treatment provider that I may be referring to. And this is important because when you're talking to someone, it's kind of hard to just having to say all that. But I do explain to the client that I'm asking these questions so that when I make the referral, I know that the service that they have will fit you, and this is what you want. So we do that, and that takes about 10 minutes to get them screened. And then I spend 10 minutes off the phone with them, kind of just calling some of my treatment providers and letting them know, hey, so-and-so is looking for a bed and they have this going on. Do you have a bed available? Yes. Then I call the client back, let them know, hey, they can expect you in X amount of time. And so that's one of the things that we're doing now. In the future, we will have a similar screening process, but we will have a safer stations location where the individual will have that brief medical screen and wound care if needed. And that will be provided by a paramedic at that time before going to treatment. So when, and Caitlin, jump in if I miss anything, okay? So when this model was revamped, we considered how much was just on the plates of our first responders at that time. And then the pandemic and the opioid epidemic added even more to those plates, and they were just overwhelmed. And they let us know that they were overwhelmed. They had to focus their available resources on the core scope of the services that they had to offer. And so that's when we started thinking about how can we do this new model where that we're not pulling the first responders from their first roles and their first duties. And so we thought that it would be best to incorporate, incorporate still first responders, but contract with first responders who can be able to provide those assessments and focus directly on the SAFER project. Am I missing anything?
Yeah, I mean, you really hit it. So for those who aren't aware, the Safe Stations program actually was born in the city of Whitehall with the Whitehall Fire Department through a great partnership between the Board of Commissioners and the city of Whitehall. And it was incredibly successful. Over 1,200 people walked into that fire station and were connected to same-day treatment and transported to treatment. It was amazing. But like Morgan said, the pandemic really changed a lot. And we had some really honest conversations that I'm so grateful that they were upfront and honest with us. And so we took all the efforts that Morgan discussed. And so SAFER Stations is actually going to be a standalone facility. We're taking it out of a fire station, but it's going to have a very similar model. And like Morgan said, we're still operating from a medical model. We want to make sure the clients or those seeking treatment are medically stable for treatment, remove all barriers to treatment access. So we will still have EMTs, paramedics on site. They will just be contractors. You know, it's also really difficult within the first responder community. So with everything that they do, their training on addiction science is fairly limited. They are provided this wonderful generalist knowledge in their training, but they only have a couple hours of curriculum focused on addiction science. And so a lot of jurisdictions across the nation, we're a part of national conversation on this, have told us, Franklin County, hey, we love your program, but we really struggle with breaking through the cultural differences in first responders and behavioral health. We're having the conversations, but it's just not getting there. And one thing that Franklin County does well is we innovate programs to serve our residents, but we also make sure it can be replicated across the country. And so what this model is going to allow these other communities to do is have an option that exists outside of their jurisdictional first responders. And so we're taking what we know works, applying it in this new setting with Morgan at the helm. And trust me, if you are seeking treatment, you want Morgan on your team. She is the best. She has made so many wonderful connections. She is a godsend to people who are seeking treatment, truly. And what we're doing is continuing conversations as well on the local and national level to help with those cultural differences between first responders and behavioral health when it comes to addiction science. So we're really excited for that new development, and hopefully during the summer we'll be launching that SAFER Stations.
And I do want to add another important part, the R part of SAFER Stations. We're still making sure that people have Narcan in their hands, still making sure they have fentanyl test strips. I keep some at my house, my office, and I let that person know. If you're not ready today, that's okay. Give me a location, I can meet you and drop off some harm reduction.
Thank you for sharing that resource. One of the things that I think that when we think about opioid addiction, there's this conversation, this duality conversation about opioid addiction and prevention, right? So what are some general signs or red flags that residents with mental health experiences show, but they also have addiction? Because sometimes I think people it's hard to decipher between the two, depending on what you're talking about. And, maybe a better question would be, what are some preventative measures that residents can take not to turn to opioids when they are feeling their mental health on the rise?
I can speak to some of those red flags. So if it's a person that you're used to working with, you should be able to notice their behaviors. And if you see any change in their behaviors, that could be a sign. Also, maybe missed appointments, lack of follow-up. And sometimes they'll let you know that, hey, I stopped taking my medication, or this just didn't seem to be working for me. And then even just seeing some individuals funnel through the systems who normally wouldn't be in jails when they're on their medication, when they're connected to their mental health provider. That could also be a sign that something else is going on. And you may want to start the conversation, well, since X is not working, what have you been trying that you feel may have been working or that you think will help you? And sometimes they'll tell you, well, I've been trying to self-medicate. And then you would want to have that discussion about, well, what can we do then?
Yeah, and thank you, Morgan, for the prevention. Self-care is a really easy word to throw out there, but this pandemic has really stretched so many people. And so the biggest thing as a clinician, as a human being, as a grants coordinator that I have seen is making sure you are plugged into a support system. One that if they do notice differences, feel comfortable kind of pointing them out to you. One that feels comfortable having those conversations that Morgan talked about. One that you can lean into. And not everyone is fortunate to have that support system physically locally. And that's why resources through social media that are healthy and supportive can be a great outlet. Even our recovery support groups like AANA have gone to a Zoom platform to make them even more accessible worldwide, which is incredible. And I know this seems like a shameless plug, but it is really relevant. That Credible Minds website that Andrew walked us through points to something I think is critical in understanding mental health and community. That platform doesn't say, click here if you have depression, click here if you have anxiety, click here if you have. People in the mental health community find community and connection through symptoms and how they show up in our daily life, right? We find that connection through, I am burnt out as a parent. We find that connection through talking to other human beings who are in similar circumstances to us, with lived experience and peer support. And so it's making sure you have those connections in the community. For those who are justice involved, if you access our phone line or website, we'll make sure that you have a great community support program around you to help you navigate this time. But also making sure in the background, you have a few, maybe 2 or 3 key things that work for you and help make you feel supported that you continue to do during this time.
That's awesome. Thank you for sharing that. And again, we're going to go over that Credible Minds platform one more time before we get out of here. But just going back to some of the things we talked about before with all these resources. So, Caitlin, thinking about the Office of Justice Policy and Programs, what are the eligibility requirements? Am I eligible? Do you need proof of insurance? Do you need proof of income? Like, what do I need in order to access your resources, as well as even our safe stations? When I go there, they're going to ask me for eligibility requirements.
Sure. And the great news is with the vast majority of our office's initiatives, there's not eligibility requirements. A big part of what we do is connect you to longer term treatment. We help you navigate the different systems that you need to get connected to. And there's no eligibility for that. It's simply a phone call or accessing our website, walking into the Rapid Resource Center. If you have questions about one of our specific programs, so like the I Father a Child program or the Pathways programs, they do have some eligibility criteria. The best thing to do is call our office and they'll connect you with the staff member who can talk you through that. And Morgan can touch base more on Safe Stations eligibility.
Yep. Short answer, anyone can come, regardless of age, insurance, legal issues, or residential status. We have the resources available to help them, and we have the staff to help them navigate through that. One thing that could be challenging is just someone coming out of jail or who just may not have insurance. We can connect them to a specialist to start that application, send it over to JFS. or there are treatment providers who will kind of sponsor an individual. So no, just show up.
So it looks like I don't think we have questions right now, but let me ask you both this. If you were listening today, right, what question would you want someone to ask you? And then what answer would you give them?
I think it's also important to note that when you come to the safe station or when you call, we're not running a background check on you. You don't have to worry about us seeing if you have any warrants. It doesn't matter. Anyone can come get treatment. Treatment is a priority.
And I would, expanding upon what we just talked about, there is no barrier too big. Whatever it is in your mind that maybe has prevented you from calling, reaching out, connecting, anything like that before, there's no barrier too big. We will help you navigate anything, whether that's getting access to naloxone. We have that amazing relationship with the JFS outreach team that Morgan noted to get you quick access to medical and food assistance. We have access to employment programs specifically geared towards residents with history of justice involvement, which is really important. We have peer support and treatment linkage. And we also have access to vouchers for state IDs and birth certificates. So there is no barrier too big. Please let us help.
And I also let individuals know when they're coming off the streets, if you need a hygiene bag to get you to make you just feel comfortable when you get to that location, let me know. I'll drop one off.
That is so awesome. You know, again, going back to just empathy and compassion as we're talking about these issues, it's so important to have that approach in working with the various residents and families who deal with, you know, everything from addiction to mental health services. So I really appreciate that approach that you both have touched on today. So I really want if Andrew can jump back on really quick. Andrew, can you go back and pull up the Credible Minds website just one more time for us?
Absolutely.
I know there's always, when you put somebody on the spot,
There we go.
always. Okay. So again, the website is, go ahead, Andrew, and it's www.credibleminds.org or .com.
Yes.
You can go onto this resource and you can take any of those self-assessments, and it even gives you how long it's going to take in order to take those assessments. So if you look at the assessment and said, okay, it's 20 minutes or 5 minutes, you can gauge it even based on that. And it gives you best practice evidence from around the world in order to assist you in self-navigating yourself out. We're also going to be leveraging this resource too, and I think the local resources are already advertised on here. You can reach into your local practitioners as well and resources. But there are best practice from around the world in order to utilize this tool. So, and we thank Adam H., who is a strong partner in developing this. We thank all our community partners in assisting us in developing this Credible Minds platform. This was a much needed resource during a very, very, very bad time during our pandemic. Is there anything that I missed, Andrew?
No, that's it.
Okay. So Morgan and Caitlin, do you all have any closing remarks?
No, there's no cap on how many times you can give me a call or walk through the doors of SAFER. We know that addiction is a relapsing disease, and we're going to be here to help you regardless, no matter how many times it takes. But thank you so much for allowing us to just be in this space and have this conversation.
Thank you.
And my only note is, especially during this time, the population that we are fortunate enough to work with, individuals with a history of justice involvement, many struggle or are trying to address mental health and substance use, is just a reminder that this group of people are some of the strongest, most resilient human beings I've ever met in my entire life. And so our role as community providers, our role in the programs that we offer, is to make sure that we are serving you and meeting your needs. And so if there's ever anything that you need addressed that we haven't gone over today, please call us. Please allow us the opportunity to help empower you and embrace your strength and resilience. We want to be here for you and make sure that you get to reach your goals.
Thank you both. Again, the information that you both shared is just overwhelmingly beneficial to our community. And this has been an educational, enriching, and much needed conversation. And I really do hope you all have learned something today, especially information you didn't previously know about mental health, well-being, and resources that are available and offered through our Franklin County Board of Commissioner Agency, Justice Policy and Programs, as well as from wonderful Morgan, who assisted us from North Central. And again, as a reminder, today was the first of our 3-part Lunch and Learn series focused on mental health, featuring the Office of Justice Policy and Programs and its local provider. Our second and third Lunch and Learn series will be held on the second Wednesday of March in April. That's Wednesday, March 9th and April 13th at 12 p.m. The upcoming discussions will center around residents struggling with mental health, including violent crimes, traumatic events, impact on families, and Franklin County resources available to residents. So with that being said, Caitlin and Morgan, is there anything else we want to leave for the people today? And do they know how to get in contact and obtain your resources? I apologize.
Yes, your team has been amazing and assured us they are putting our phone number, website for all the resources we've discussed in the Facebook Live. So please access us there. But if nothing else, remember this phone number, 614-525-5577. That's our direct office number. We'll get you where you need to go.
And again, the Credible Minds website is www.franklincountyohio.crediblemine.com. www.franklincountyohio.crediblemine.com. We ask you to please leverage that much needed resource. You can use it 24 hours, 7 days a week. It is available, it is free, and there is no qualifying indicating information that we're going to ask you for, proof of insurance, none of that. Just jump on there and utilize that tool. Again, thank you for joining us today, and we look forward to seeing you next month on Wednesday, March 9th. And I hope you all have a wonderful day. Please stay safe and stay well. And on behalf of Franklin County Commissioner John O'Grady, Kevin Boyce, and President Erica Crowley, we appreciate you all joining today.